I think people find it difficult to ask for help because they've been independent their entire life. They've had families, they've run businesses, held jobs, and later stages during their life, it's difficult to look in the mirror and see that you require help. So it is challenging for all of us to ask for help. But what people need to realise is that lots of people are getting help to remain living at home. There's over 1 million Australians at the moment receiving home care at the moment to support them to live at home. And that little bit of home care is keeping people at home rather than them having to move into residential aged care. The benefits of having support in your own home, it enables you to keep your independence and enables you to make choices about the type of care, the type of people you come in. So it does empower you to be independent and receive the supports you require at home. There are a number of home care options for people wanting to remain living at home. There's the Commonwealth Home Support Program, the Home Care Packages Program, there's private supports, and there's also accessing supports through your local community and family. The Commonwealth Home Support Program is an entry-level government-funded service system. It's there for people who are managing their own needs pretty well, but need a little bit of extra support. Some people might access the Commonwealth Home Support Program when they're recovering from illness. They may need just little bits of help around the home to help them get by. Services may include domestic support, personal care, Meals on Wheels, and home maintenance support. The Commonwealth Home Support Program is subsidised, but you do have to pay fees to contribute towards that. Before you can access the Commonwealth Home Support Program, you need an assessment, and that assessment needs to be done by the Regional Assessment Service. To have that assessment, you can contact My Aged Care and they can arrange that for you. If you think you need more or longer term assistance, then a home care package is probably the most appropriate for you. The Home Care Packages Program is a government subsidised support program that supports people to live independently in their own homes. The Home Care Package Program is a program that supports people to live in their own home but has more flexibility and is more longer term in nature. There are 4 levels of home care packages for different levels of support and care needs. Level 1 for basic needs, Level 2 for low level needs, Level 3 for intermediate needs, and Level 4 for high level needs. Each level receives a different subsidy. The higher the level, the more money you get, and the more money you get to spend on services. To get a home care package, you'll need an assessment to determine your level of need. If your needs increase, you can be reassessed to get approval for a higher level. The home care provider will offer you support and advice about where you can access those services from. The home care package funds aren't paid to you directly. They're paid to an approved provider. You need to choose that approved provider. An approved provider will work with you and provide case management and help you plan and develop a care plan to support you at home. The Commonwealth Home Support Program and the Home Care Packages Program both support you to remain living at home, but there are some differences. With the Commonwealth Home Support Program, there's a menu of services that you can choose from. You only pay for those services that you use, and you can opt in and out of those services when required. With the Home Care Packages Program, you have a case manager who will work with you and plan to develop a care plan for services that meet your needs. You get to choose those services, and the menu's a lot larger and flexible in terms of the supports you can gain access to, and it's a long-term package. People choose to use private services over government subsidised services, mainly because the flexibility they have in choosing those services. One of the key points for self-funded retirees and part pensioners is the income tested fees that people are asked to pay when accessing government subsidised services such as a home care package. This income tested fee is determined by Centrelink, and for some people they don't feel comfortable going through that process. Many companies and organisations offer fee-for-service home care. They're very flexible, there's no waiting lists, people aren't required to have an assessment, and people feel they have more control over who and where and when they come into people's homes. Although home care packages are subsidised by the Australian Federal Government, you are required to pay a fee. The fee, an income tested fee, is determined by your income and own individual circumstances. I'm a social worker by profession, and I've worked in the community care field in aged care. as a case manager, as a manager of a home care package provider, and I've got a vast experience of the community care system and how it works. People come to us for a number of reasons. Often there's been a trigger event, someone's had a fall, illness, hospital admission, and it's often family members who are concerned about their parent, grandparent, loved one, who raise those first initial concerns. So what we do is go and visit with families and the older person and have a discussion about what some of their options are. And I guess the key thing is that we're trying to support people to live in their own homes. And once people understand that, they're willing to sort of engage and take that step to ask for a little bit of help, because that's our ultimate objective, is keeping people in their own homes. A lot of talk around aged care is around residential aged care, and people feel that that's the first and only step. But once people understand that there are so many different options of support to remain in your own home, then it's really easy for us to engage with people and support them to make that happen. It's a complex system, and it's really important that you understand your options before making a decision about which way to go. And that's what we're here to do, is help you make those informed decisions.